If you followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman20 for 20% off site-wide. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. You can send questions to questions@drhoffman.net. We always need your questions in our mailbox as fodder for our Q&A discussions. And I just want to mention, I wrote an article this week. I thought you had a chance to review it. It was an article about, It was entitled, It's All About That Bass.
Yes.
You know that song, Meghan Trainor, It's All About That Bass?
Yeah.
So the point being is that Meghan Trainor, I don't know if you all keep up with pop culture, but it's one of those what do you call it, earwig songs. It just kind of like stays in your head. And around 10 years ago, she wrote a song. It's all about that bass. And I first few times I heard it, I said, why is it all about that bass? There was a bass line in that song. It's kind of a play on words because she had a big, shall we say, posterior, politely, and up top she wasn't that well endowed. So she was extolling the benefits of that type of figure for women who are not hourglass shaped.
Yeah.
And so there's actually a study that looks at glute shape and size and composition. And what they found is that men who have flat butts, the stereotype, men whose pants are falling down, and they got a big belly overhang in their belt. Probably need suspenders. They got a 6-pack of beer. They're slinging that in one hand, and they're probably smoking a cigarette.
Yes,
that is a metabolic syndrome, pre-diabetes or full-blown type 2 diabetes thing. Flat butt in men. In women, it's the opposite. Big butts are associated with diabetes risk, according to a study of 60-some thousand MRIs of the butt.
Wow.
Okay. So they analyzed it. And but it's not just the size of your butt, it's the composition of your butt, because you can have because women have big butts, that's not necessarily protective against diabetes. What it has to do is the glute muscle is the biggest muscle in your body, your butt muscle. And it actually helps keep us upright. It stabilizes our hips and our knees and our backs and does a lot of work. And if it's underdeveloped, you're not secreting the myokines, these natural substances that actually help with blood sugar control. And so, and you could have a big butt, but if it's just a fat depot, which is women store fat in certain strategic places. That's men like that. That is an evolutionary adaptation.
Yes.
I don't know if you saw like the Stone Age Venus. The Stone Age Venus that is like there's like it's actually in the Metropolitan Museums. When you go into the Greek and Roman thing as a prelude to that, you see this little tiny statue, which is this really kind of fat woman, but it was like a fertility symbol. And to be well fed in prehistoric times was considered a plus.
Yeah.
And so,
If you were a little portly, yeah.
And that's an evolutionary adaptation, is that a big butt could signal to the male potential procreator that there was great fertility potential in this woman, and go for it. And I guess men are programmed to, you got to look at the posteriors of women.
To look at a shapely figure, yeah.
But if it's too big, it's pre-diabetic. So anyway.
Okay.
Bottom line, that's a pun. Don't inject silicone into your butt, because that's not going to help.
Gosh.
Yeah.
Oh my goodness. Yeah.
Or do liposuction. There's actually something called a BBL, Brazilian butt lift. It's a cosmetic procedure. And it's actually one of the most dangerous of cosmetic procedures, because it's a 2-step procedure. You suck fat out of your belly and you shoot it into your butt. And it can, women have died doing that procedure. I mean, it's being done, but it can, and you can get a lumpy butt or infection or inflammation.
Or some other kind of thing.
Yeah.
That's not where that fat belongs. Okay.
No, if you want a big butt, you want a big butt, do squats, do deadlifts.
It will lift the butt. It will round the butt.
Yeah.
So you're not having the flat butt or the dead butt syndrome, as you write about so eloquently in that article. All of that. So, yeah.
Anyway, so check out that article if you haven't seen it. I mean, you get it in the newsletter for free, so subscribe to our newsletter. Yeah. Anyway, let's get to questions.
Yes. This comes from Domenica. I have had reflux for 25 years, and I've been taking Nexium on and off. And as you've mentioned, that could be a good alternative. So I take Famotidine, that's Pepsid, 2 to 3 times a day. It helps keep me off Nexium most of the time. Endorphin helps. Alkaline water was
so what
really
is explain what endorphin is, please.
Endorphin has some demulcent in it. It's got some EGCG in there. It's got apple
slippery
powder,
elm, I think.
Slippery elm, maybe some marshmallow. Yes. And it can be really, really good for
it comes in a powder, right?
Yeah. It does. It comes in a powder. You take like 2 tablespoons twice a day in water. In between meals. That would be the way to take it.
It's very helpful.
So the fact that
it's available in full script.
Helps.
It's available in full script. Yeah. So it's our online dispensary, dearhoffmanstore.com.
Right. Domenica says, I do limit fried foods, red wine, and food, and seltzer that comes in a can.
I'm not sure why the can thing. I mean, any seltzer.
Yeah. Any seltzer would be, any seltzer.
And for 2 reasons. One is seltzer's a little acidic, number one, but also seltzer kind of causes some reflux. It's a gas, and it tends to rise and push up the stomach contents. And you either pleasantly belch or you regurgitate, and there's an acid splash with that for some people. Yeah.
Absolutely. So, Domenica, you need to be on a proper diet for the GERD. The fact that endorphin does help, you should be taking that. And maybe some deglycerizated licorice, like DGL.
Which comes in lozenges. Lozenges.
You could do lozenges. Alkaline water wouldn't really be of any help. I don't think. I think that's a bit of a, yeah. So taking digestive enzymes, getting off gluten.
To differentiate, there's 2 old-fashioned ulcer medications were Famotidine and Cimetidine. There was Tagamet and Pepsid. Yeah. And they took Tagamet off the market. Pepsid is available over the counter, and it is a fast-acting but weaker acid blocker. It's a different principle than what are called the proton pump inhibitors. The proton pump inhibitors take longer to work. So if you think that, I have heartburn, I'm going to take one of those now for relief, you have to take them consistently for a few days to get the effect. And so for immediate relief, it's probably better to take Pepsid. But, and Pepsid has, I think, less in the way of a side effect profile. It's less likely to deplete magnesium, cause osteoporosis, cause any number of problems that are associated with long-term PPI use. So that is actually good if you can step away from the PPIs and use Pepcid. That's a step down and an off-ramp.
Mm-hmm. Domenica, you do say that you do limit fried foods, red wine, all of that. You need to be on a proper GERD diet. Qualified nutritionist can help you in that endeavor and get you on the appropriate supplements. If you really want to beat this thing and not just stay away from Nexium, but finally get off the Famotidine, except for maybe once or twice a month when you know you've overindulged or something like that. Take it the way it's meant to be taken, that way.
And low-carb diets can be helpful. Very low-carb diets can be helpful.
Absolutely. That could cure a whole lot of things. So consider that. All right. Let us know how you're doing. Thank you, Domenica.
So we take a moment to allow one of our sponsors an opportunity to share an important message. Let's do that now.
Yes. Okay.
Okay, listen up.
Kids don't just bring home homework, they bring home germs. And those germs don't just stay with them, they spread to the whole household. That's why Clear Nasal Spray was created by a practicing physician to give parents and grandparents peace of mind. You may not think about it, but your nose is filtering out a semi-truck full of air every single day. Clear isn't just another spray. It creates an additional layer of protection in your nose that blocks bacteria and viruses before they can even take hold. Yes, even that virus. Supporting your body's defenses right where germs first try to enter. Clear is a hygiene product recommended for daily use, drug-free, non-drowsy, and safe for all ages. Just a quick spray in the morning and evening helps you cleanse your nose. Don't just hope for protection, create it. Get Clear Nasal Spray, your daily defense. Clear Nasal Spray is available at retailers nationwide and online. Check out Xlear.com for our special offers. That's Xlear.com.
Thanks for listening, and thanks for supporting our sponsors. They make intelligent medicine a continuing free resource to you through their generous underwriting. And now back to our questions. What's next, Leyla?
This comes from Jan. Hello. I recall when Dr. Hoffman had a biking accident and he designed a specific supplement protocol for healing. I know that Dr. Hoffman shared that protocol, but I'm unable to find it. Would you be kind enough to point me in the right direction or directly share the protocol?
It's still up on our website, but it's been 20 years. It was in 2006. I'm now commemorating the 20th anniversary.
That long ago?
Yeah, it's unbelievable. Wow. Unbelievable. Because I was training for the New York City Triathlon, which I was eager to participate in. And I had a little bike crash and broke my femur.
I remember.
So it's what's called a high femoral fracture. Fortunately, it didn't require hip replacement. And I got to say, I really healed very well, thanks to the expertise of my surgeon at Cornell and HHS, Hospital for Special Surgery. I mean, it was remarkable because this is the kind of injury that if it had happened in a previous era, even if it happened maybe 50 years ago, I'd be walking like Chester in Gunsmoke, limping.
Oh, my.
Yeah. Because... but it's amazing what orthopedic surgery can do. So credit to orthopedic surgeons. So what I did was I just rather than recite all the nutrients, yes, of course, calcium. I think calcium can make a difference. And getting adequate vitamin D for bone formation and vitamin C for healing. And also in the immediate aftermath of an injury, you might want to take something like proteolytic enzyme with bromelain.
Yes.
And one of the products is called, what is it?
There's Wobenzyme.
Wobenzyme.
And there's also...
There's other things.
Yeah. There are other enzymes, pancreatic enzymes as well, that are helpful.
Yeah. So I think that would be important, zinc for, healing and regeneration. I would say that, at the time, I wasn't low in testosterone, but an older man, if I were to see an older man who has an injury like that, I think it would actually be very helpful to use testosterone because it's very anabolic. And it also helps to prevent the kind of frailty that develops in the aftermath of a big injury like that. So I remember actually, in a few months after doing that, I put on a suit to go to the office. And I felt like a scarecrow in the suit. I had actually lost a lot of my lean body mass because I was unable to exercise. And also, injuries are very catabolic. They break down muscle.
They require a whole lot of protein. Your protein needs are actually much higher after a trauma, a surgery, all of that. Yes.
So it's now that the statute of limitations has expired, I'm kidding. It wasn't a crime to do this, but I accessed growth hormone, and I took growth hormone at the time. And I think that growth hormone is an underutilized thing in injuries because growth hormone is helpful for repair. And because its use has been kind of rampant as a longevity drug, and I think you can go wrong with the dosing and, the safety issues around it. But I think when used judiciously, growth hormone can be very helpful for healing fractures and for coming back from major surgery. So I used that for a while. I didn't, stay on it forever. So that could be part of a protocol. Again, that's not something you can access on your own. You have to get it from a physician.
Right. And also you had some really good physical therapy that I remember.
I had some good physical therapy. And then, what happened was I did the physical therapy and it was hard. It was like, it's like, but I worked at it. And then they said, okay, you're done. You're discharged. This is all the insurance will allow. And I went to my Y and they assigned me a personal trainer. And
terrific.
He said, I'm going to rebuild you. And 20 years later, I'm still working with him,
Wow.
So he knows my body. Kudos to him. Kudos to Victor, who, has helped me and continues to help me. But, he had me doing a lot of stuff to build me back up. But, I worked really hard to get back up. And subsequently, I missed a year of triathlons. Within 2 years, I was doing triathlons again. And I, subsequently was able to run, bike, swim, everything. And, I don't think there's any long-term consequences of it now, surprisingly.
Yeah. And sometime later, Dr. Hoffman, you had that rod removed.
Yeah, I had a metal rod put in there. And they said, well, if you're over 50, we leave it in because then you're indestructible. You never can break your hip because you got a metal rod in your hip. And I said, take it out. Because because I'm thin, when I was lying on my side, women have kind of padding around their hips, but I could actually feel the tip of the metal protruding. And I said, I don't want that.
Okay.
Yeah.
Yeah.
I just didn't like the idea. It's like this foreign thing in my body.
You're right.
Take it out, Yeah.
Take it out. So that's out and everything is great. Everything is good.
Yep. It's all original parts,
All right. Jan, thank you for your question. There you go. Okay. Let's see. Oh, this comes from Warren. Warren says, I had an enlarged prostate. I was taking a good amount of curcumin and many other supplements.
Curcumin.
What? Yeah. One night while urinating, I bled some. The next day, I bled on and off with some blood clots. This went on for 4 days.
Just spontaneously, just like that.
Yeah. Later, I had a surgical procedure for my prostate and no cancer was found.
Okay.
Warren is asking, do you think I had prostate cancer at that time?
Whoa.
Look into your crystal ball, Dr. Hoff.
So is the implication that the curcumin cured his prostate cancer? Or, I don't know.
I can't read it any other way. It appears that, Warren is wondering that.
Okay, so
curcumin as well as many other supplements.
Yeah, I mean, I don't know what caused the bleeding. It might have been a urinary tract infection or it might have been trauma of some kind. BPH is an enlarged prostate, not necessarily associated with bleeding, but I guess under some circumstances it could be. Blood in the urine is a concern, obviously, and even more so in men than in women.
Sure.
Although both require workup to see if you have bladder cancer or prostate cancer or kidney cancer. cancer of the ureters, you need a complete workup if you have what's called hematuria. But hematuria can occur for a variety of reasons. It could be, runners get hematuria. After a long run, one time I had runner's hematuria. Like it was from a lot of bouncing of the bladder, and then there was some trauma to small blood vessels, and it was scary, but it turned out to be nothing. But you have to figure. Oh, could be stones. Kidney stones. Kidney stones can cause
passing stones.
Yeah.
Right. You don't necessarily feel that all the time. Some people it's horrible, and others it's down. It's gone. Whatever.
Exactly.
Yeah.
So he had an enlarged prostate, and so when you do, they take out this added tissue. They kind of do it's like a prostate reduction surgery. They don't remove your prostate. They kind of scrape it and laser it or freeze it or there's all these different ways to get it, to shrink it. And so then they get some tissue sample because they also want to know, like, in addition to enlargement, could there be cancer there? So, well, great, congratulations, no cancer. So, I mean, if they say there's no cancer, there's probably no cancer. I mean, the only possibility is that in the remaining prostate tissue there was cancer, and the sample they analyzed didn't reveal it. But I would take a cue from the urologist. I would follow a PSA, maybe. And, if you're unsure, get an MRI just to see if there's something going on there. There are other tests that can determine if you have prostate cancer.
Right. Warren, there you go. I wonder if Warren's still taking his curcumin and many other supplements. So,
and what the curcumin has to do with it, I'm not sure, except that curcumin has anti-cancer effects. Yes.
True.
Right.
Yeah, and it's anti-inflammatory and all of that, so that could be helpful. So, Warren, thank you for that. Okay. Oh, here's a good one from Jillian. Hi, Dr. Hoffman and Leyla. What is your opinion on heart and lung scans that look at the anatomy of the heart and lungs and are marketed to detect disease, cancer, tumors, abnormalities, etc.? They also offer full body scans, bone density scans, virtual colonoscopies.
I know.
By the way, love your show and appreciate all the advice you give.
It's like Scanorama, and it is. I have to say that when it comes to whole body scans, I'm against them because whole body scans, and actually most responsible medical authorities deplore whole body scans. Except if you have had a test that indicates that you have cancer and we don't know where it is, you might do a whole body scan. So just for screening in a healthy person, I wouldn't do a whole body scan because it might reveal the presence of something that's incidental, that is suspicious, and then you go down the rabbit hole of anxiety and unnecessary testing.
Now you got to go check it out.
And so, no, I wouldn't do that.
Testing, over-treatment, right.
However, I am for what's called heart scanning. I think that heart scanning is helpful for making a decision about how aggressive you have to be about cardiovascular prevention, whether you need to be on a aggressive drug regimen to lower your cholesterol. If you have a high cholesterol, I mean, an example of which is I have a moderately high cholesterol, but when I did my heart scan, I had zero plaque. So it would not be that advantageous. Studies would show that people who have zero plaque, they progress very slowly. If I had zero plaque at the age of 30, that might be a different story, but I had that test done when I was 65. And so it is unlikely that in the remaining 30 some odd years of my life that I would acquire enough plaque to have clinical heart disease. There's also a lung scan smokers are advised to get CT scans or potentially MRIs, I guess. But CT scans, there's some kind of a spiral CT, which is useful for picking up lung cancer early. The argument against that is that it used to be that, lung cancer used to be just virtually a death sentence at any point in time. And so what's the point of finding it? Because you're going to die anyway. Well, they've actually improved in the treatment of lung cancer. And while 5-year survival of lung cancer is on the order of, less than 50%, they now can surgically treat it, hopefully get the whole thing. They can also use various types of old-fashioned chemo and radiation, but now with immunotherapy, you might actually have a bite at the apple of survival. So maybe early detection for somebody at high risk. But to randomly take people and expose them to a lot of x-rays as CTs do for like, let's screen you for lung cancer. It used to be like we'd have people come in and get their annual x-ray. Well, if you're a non-smoker and you're not coughing and you're not spitting up blood, it's just a moneymaker for the doctor or the hospital.
It's a moneymaker.
Yeah.
That would be the reason. And for early treatments of things that maybe didn't need such aggressive treatment. That's
it's a good point which to mention. There's something. Have you ever had shoulder pain?
Shoulder pain? Yes, I have.
You have shoulder. Man.
No, I don't currently, but I had.
But have you ever had shoulder? Like, how frequent do people past the age of 35 or 40 have shoulder pain, right? Especially if you're active.
Yeah.
So the immediate impulse is, I got to get an MRI. I got to get an MRI, right? I got to see what's going on. I want to see what's going on. You're right. They just did a study. They looked at people over 40 who had shoulder pain and got MRIs. And what they found is that, and then they also compared it to people who had no shoulder pain over 40 and MRIs. Mm-hmm. They found that I think it was like 99% of people over 40 had detectable abnormalities on MRI in their shoulders. Mm-hmm. Because guess what? There's tiny little rubber bands, ligaments and tendons in your shoulder, and they fray as you get older. They just do.
Sure. They do.
And so you're going to get a report like, oh my God, I got this, I got that, and then you might unnecessarily undergo a procedure. Mm-hmm. And I think, ethical orthopedists and shoulder specialists these days will reassure you that physical therapy is the way to go. And only in the most egregious cases would we undertake surgery. But there's billions of dollars being spent on these MRIs, which are meaningless.
I know. So much. Anyway, the shoulder pain went away.
Duh. Right.
Another thing that happens, Dr. Hoffman, is people, they get scared. They've got a pain. They've got this. They've got that symptom, this symptom. And, wait a couple of weeks.
Yeah.
Are you not? If you're not better, absolutely go
or even
find
be
out
patient.
What's going on.
Wait 3 months. Wait 6 months. Yeah.
Maybe your body's trying to work something out.
Yeah.
Maybe that pain is in your shoulder is part of the remedy that your body itself is trying to work out. So, let your body do its thing. And then when you still feel like things are awry, you go to the doctor. Absolutely.
I do shoulder stabilizing exercises because I value my shoulders because I swim. Sure. And, one of the limiting factors for swimmers is shoulder pain. But I try in the gym to use very light weights to strengthen my shoulder girdle, which is these muscles that, the rotator, basically the rotator cuff.
Rotator cuff, right.
Rotator muscles that stabilize the shoulder. So, anyway, but just an aside, I think imaging is problematic because it can sometimes be discouraging and you can see all kinds of abnormalities and it makes you feel like you're falling apart when actually structure does not dictate function. You can function fine with a small degree of scoliosis or with some arthritis in your spine or, some,
here's another example of that. Back when my mother was alive, she went for one of these full body scans. It had to be about 20 years ago or so, when she was in her, no, it was earlier than that, maybe in her early to mid 70s. She went for a full body scan and she brings me the report and I'm reading the report and there's a cyst on her pancreas and a cyst on her liver. Oh my God, what's nothing. It's a cyst. And if the doctor looked at this and interpreted and said nothing to you, there's nothing to talk about. There's nothing to be concerned about. They didn't tell you, oh my God, you got to get this cyst checked out on your pancreas and your liver. There's nothing to do here. Whatever, so, and that's not what took her anyway. So,
Anyway.
So it could be cause for a lot of anxiety. Yeah. I for one, am not a fan unless there's something happening.
God forbid,
I need to check it out.
Please don't do a routine MRI of my brain. I don't want to see it. I do not want to see what my brain looks like. It's working fine. Yeah. I do not want to see my shrunken, gray matter, my white matter abnormality, all this stuff that they find
and all
that
of
are
that.
they're kind of like acne in teenagers.
Yeah.
In people over
Nothing's
the age
gonna
of 65, it's like,
Yeah.
yeah.
Yeah. So, Julian, thank you very much for that question. I should also bring up, Dr. Hoffman, that, people who are getting dental cleanings every 6 months, you don't need to get an x-ray every 6 months.
I demur, but
yeah, I do too.
But if I got a problem,
yeah, me
then
too.
I
I'll
say,
say
please
take the
take a
x-ray.
look at it. But the routine x-ray, I decline, and they actually are mad at me for doing that because two reasons. One is it's a moneymaker, but I also have to they say that it's important for them so they know what to do. Yeah. And without it, they just have to pick away at your teeth, and with a pick to see if there's sensitive areas. But hey,
every time I go for a cleaning, I have to sign an authorization that says, I do not hold them responsible for what they do not find because I didn't want the x-ray.
Yeah. We haven't even discussed it, but we're kindred spirits in that respect.
Yeah. Yeah.
The dentists may be mad at us who listen to this, but hey, listen, guess what? If you're a dentist and you have a comment, please share it. It's questions@drhoffman.net. Maybe you've got,
Yeah, Dr. Hoffman, years ago when my old dentist was alive, Dr. Green, God rest his soul, I loved him. Because I would never take his x-rays except like once every 4 to 5 years or something, right? He used like an infrared little pen light.
Okay.
Because I had no fillings,
right?
He was able to see. Oh. He was able to use that and see if anything was going on.
It's an alternative. Okay.
Which was great.
That may
work. How come that's not offered to me how come that's not offered? Anyway.
I can't tell you since I'm not a dentist. Maybe a dentist can, a professional healthcare dental professional can weigh in on that. Do we have time for a brief question? Because this is like your bonus question for today.
Okay. We've got actually one from Sandy. My husband just had hip replacement surgery. I wanted him to take bromelain as per your recommendations of supplements after surgery. Harking back to your question of yours, Dr. Hoffman.
Right.
I was wondering if there could be an adverse effect of taking bromelain while also taking a baby aspirin or Tylenol or anything like that.
Bromelain is not something that makes you bleed more. I don't think that there is any additive effect that could be. But, probably you're asked not to take aspirin when you're getting a hip replacement, if I'm not mistaken, because of the potential for, perioperative bleeding. On the other hand, sometimes you do get blood thinners in the immediate aftermath of surgery. I did because there's a tendency if you lie in bed, and especially if you have trauma, that you will get a blood clot. And then the blood clot can travel up into your lungs and you can get a PE, pulmonary embolus, which is devastating. And so you generally, at the time of surgery, I don't think you're supposed to have any kind of blood thinner, but the bromelain would be in the aftermath and it would be ideal.
Right. It would
it's
be
not
ideal.
A blood thinner per se. I don't know bromelain per se is a blood thinner.
Yeah. And then after surgery, generally for 2 to 3 months, at least 6 weeks, taking bromelain is helpful to prevent scar tissue and things like that.
Yeah. Plastic surgeons use it. Yeah.
Yeah. Sandy, thank you for your question. And a reminder to all of you, questions@drhoffman.net. That's questions@drhoffman.net. And don't forget, you can shop hundreds of curated, vetted supplements in Dr.
Score some of that endorphin. Score some of that endorphin there. You've got
Get
GERD.
some endorphin.
Yeah.
Exactly. Go to drhoffmanstore.com. That's drhoffmanstore.com. You could begin with a starter kit. You could expand with additional protocols tailored to your particular concerns like allergy or bone health, brain health, detox, sleep and stress support. Buying through FullScript offers fast free shipping, optional refill reminders via text or email, and multiple payment options like Apple and Google Pay. It's safe, secure, and it includes world-class service. That's drhoffmanstore.com, drhoffmanstore.com.
I got to check downstairs in my building because I think I might have a shipment coming in.
You might have a shipment, right?
Yeah. Well,
Yep.
let's see. I ordered it yesterday. That's a taller. But it's probably going to come tomorrow. So 2 days. That's
There you
not
go.
pretty quick.
Not bad.
Yeah.
Not bad.
Okay. So thank you, Leyla. And once again, we will reconvene
Yes.
next week for another Q&A with Leyla. Questions@drhoffman.net is the place to send questions or comments. Thanks for being with us. I'm Dr. Ronald Hoffman. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.